Right. Good afternoon, everybody, and welcome to Board of Health for the month of September. So nice to see everybody. We have a really full agenda today, so we're going to kind of power through this as quickly as we can, but we do have quite a few enforcement actions and other things to do updates on. We do not have anybody for privilege of the floor today, so I'm going to move right to the approval of the minutes. We have two sets of minutes that we have to approve. So the first one is a memory test. You have to remember if you were at the July meeting. So if you can't remember, look at the minutes. So just the folks who were at the July meeting, can I get a motion from one of the, okay, for Shauna to approve as written, and I need a second. From, you were there, you, good, that was a good memory test, yes, from Samara. So any discussion on these? All right, everyone in favor is written. 1, 2, 3, 4, 5, yes, okay, we got 5, great. So we'll do the same thing on our August 24th meeting minutes as well. I'll need a first on that from Melissa. And a second from Shauna, although Frank, can we still vote on them even though there was only 4 people at that meeting? Okay.
Yeah, I think everyone can vote.
Okay. Well, actually only 3 of us are, everyone can vote, go ahead and vote. Okay, yeah. So all in favor is written. Anybody opposed? Okay, great. Any abstentions? Sorry, I think I didn't ask that on the first one. All right, great. So let's go ahead and move forward. So Brenda with financial summary.
The August 2021 financial summary was included in your packet. I think the only thing I can add is we are busy working to get our public health fellows grant into the state. The school grant of about 2.6 million needs some revisions, and it'll go back into HRI. And Liz has gotten her RFP out for her CDBG grant of $855,000. So we're busy doing a lot of grant work right now.
Brenda, I thank you. I just wanted the question on the expenditures. Thank you for the paragraph that you provided about the sampling costs. Are those, is that going to get backed out of the public health administration line item, or is there a different line item? The COVID related stuff.
The testing expenses are coming out of 4010 Public Health Administration, and this county has received some FEMA money. I don't know when they'll adjust revenue onto our books that will help cover that.
Okay, great. Okay, thank you. Other questions for Brenda? All right, great. Thanks, Brenda. Okay, let's go to the divisional reports next. Frank.
Sure. Good afternoon, everyone. Just to follow up on Brenda, Thursday, Brenda, Harmony, Jeremy, and I will be doing our budget presentations to the legislature. So if you want to watch, you're welcome to. We're slated for 5:40, but they've been going a little bit quicker. So if you want to get on by 5:15, 5:30, yeah, you can probably catch us. It's on their YouTube, the county's YouTube page. Lots going on around COVID since the last time we met. K through 12, pre-K through 12 has begun. Our districts have done a great job being prepared, and so far we are seeing cases, but not large numbers of cases. I think every district has been touched at this point. We have not confirmed in-school transmission at this point. There are some that are, maybe, but it's hard to really point out for certain. But in any instance, we're talking about 1s and 2s, not, dozens of positive cases. So that's good. I think we've been working well with the districts on limiting how many kids actually get quarantined as well, trying to limit the time away from in-person learning for the kids. So good news on that front so far. Lots going on with guidance, particularly around the booster vaccine. So you're probably aware by now that boosters have been approved for certain people, those over 65 or living in long-term care, those from 50 to 65 with underlying health conditions, and those 18 to 64 with jobs that could potentially put them at high risk for exposure. So we just put a press release out today on that. So there's more information on our website. We are right now pointing people to pharmacies and their healthcare providers because vaccine is readily available in the community. We are planning to have some vaccine available at the mall. As you can imagine, for the hospital system, these are difficult times from a staffing perspective. So they've graciously allowed us to use the mall space and some of the infrastructure there, but we're putting together vaccination teams. So we're working diligently, hopefully. We're working towards having the mall site open at a much smaller capacity than previously, but still open beginning next week, the end of next week. We're looking to try to have evening hours on Thursday, all day Friday, and all day Saturday. But that will really depend on staffing and what we're able to muster up here in the next week. So more to come on that, but we are working to make it available. And I'll leave disease for Claire, so she has something to share. I think those are the big things really going on. I'm happy to answer any questions that anyone has.
Okay, any questions for Frank? Ed?
It's just a quick question, Frank, about you mentioned about limiting quarantine for in-school transmissions. What do you mean by that? I wasn't clear.
Well, we're essentially following guidance. The state and federal guidance for pre-K through 12 is that in the classroom setting, students are not considered an exposure unless they were within 3 feet for more than 15 minutes.
Okay.
So really, classroom exposure amongst kids, as long as they are masked, is very, very limited, and all of our districts are requiring masking. Most of the adults are vaccinated, so even if they were a contact, they wouldn't need to quarantine. Our biggest challenge has been buses. A school bus is different than a classroom, and knowing who's sitting where has been a bit more challenging, but even there, we're trying to limit it to what the guidance specifically says, which is within 6 feet for more than 15 minutes. So really, when we have a child case in the school, we're talking about a half a dozen contacts instead of 30 or 40 like we saw last year.
Okay, thank you.
And Frank, the boosters are just for those who receive Pfizer?
Yes. Thanks, Dr. Evelyn. Yes, it's just for those that have received the first 2 doses of Pfizer as their vaccine. There's studies still going on with Moderna and J&J, but right now it's just for Pfizer.
Other questions? Okay, if you don't mind, can I change the order just slightly to have Claire go next? Because I'm assuming that a lot of your conversation will be about COVID, just to kind of keep going with that. And then we'll go to Sam after Claire. Go ahead, Claire.
Okay, thanks. Yeah, so to just sort of echo what's in the report and what Frank has shared, August was a busy month, and the Community Health Division has really been focused 100% on COVID for the response. There were about 750 COVID cases in the month of August, and almost 2,000 contacts generated from those cases. We also responded to record number of phone calls from the public, and we're trying to respond to those as quickly as possible. But of course, our priorities are to reach the new cases, get those investigated, and complete contact tracing as soon as possible. I would say over the month of August, we scaled up our response significantly during that time. So we have additional per diem nurses to help with case investigations and project assistants who help us with monitoring cases to meet the demand in what we hope is an efficient and sustainable way, so we can adjust quickly to the changing context with COVID spikes and drops as needed. And we've also engaged with the virtual call center at the state level with New York State Department of Health to support with up to 10 case investigations on days that we need them as a backup. And I just wanted to mention to this group as well, a special thank you is in order for the county teams who have reaffected their staff to help with the response during this time. Also, particularly to the Human Resources Department for their support, and our admin team at the Health Department, Brenda, Sun, and Karen, for their incredible efforts to assist in and make it happen, really, to allow us to get this team in place really quickly. Deb Thomas and the CSDN division nurses as well deserve a real hats off, because they stepped in when we needed them. We wouldn't have been able to manage the case investigations in the time that we needed to without their help. And so they contributed, really juggling and balancing their work with early intervention and the COVID support to allow us to get through that. So we're also optimistic for them that this new team will allow them to get back to their really important service work, which has been delayed because of the COVID support that they've provided. Also, other divisions within the health department, Sam and Ted, especially with support for public inquiries and public communication, and to EH and the support staff for the assistance with all of the calls that are coming in, public inquiries, et cetera. So also the allowance sort of taking away other responsibilities from us that allow us to focus on COVID, like the work with rabies inquiries that EH team has really stepped up. So we're just really grateful. And then lastly, wanted to mention, the orientation, training, and management efforts of this expanded team are significant, and the full-time nursing staff and senior nurse managers, Celeste and Rachel, have done an incredible job putting this in place, keeping things running. Their commitment to the quality and the service to the community is as high as ever. They amaze me. And so, we continue to kind of move through this Delta wave and prioritizing new case investigations. Also, as Frank mentioned, we're adapting our approach to contact tracing, particularly with higher education, to minimize unnecessary quarantine where possible, and then working through the guidance, sometimes the absence of it from the state, to help people understand what to do. And so I think I'm happy to answer any other questions, but I think that kind of summarizes where we're at.
Thanks, Claire. Any questions for Claire? Okay. And I guess, again, from all of us, thank you to everybody at the department who's done so much work on this. We know that it's been a really long haul for all of you, so appreciate everything that you've done. Okay, Sam, health promotion.
Thank you. Hi, everyone. Just in addition to my report, I wanted to give a quick update on our strategic planning efforts and implementation. That I think we had mentioned that we started 2 cross-functional teams, which is a mix of staff from both mental health and public health, to look at services and integration. And so we did both teams reassess sort of their timeline and workload, especially in the context of COVID. And so the services team is on hold and they're going to reassess in October. But they had started working on some updates of our internal staff directory, which has been a really useful tool that we developed in December of 2019 when we first got everyone together. And we'll continue to work on that as lots of new staff have come on as well. So it'll continue to be a valuable tool to use. And then the integration team is continuing with support from the Batiste Group, our consultant, and we're in a research phase where we're looking into rebranding processes and how to really communicate the new identity of the department. So we've been speaking with some other counties as well who have gone through a similar process. So we had a conversation with Livingston County and Dutchess County, and I believe both of them were also used as a resource when the legislature reviewed and the boards reviewed the integration of the departments. So we had really productive conversations and some good lessons learned from both of those counties that we'll continue to move forward with the team. So that's what's happening with strategic planning right now. And then the other thing I want to mention is that the county has adopted a new platform for online like newsletters and ways of emailing out information and updates. So it's called Gov Delivery. And I believe on the homepage of the county site, there's now an option to sign up for different updates from different departments. And it's just in its beginning stages, but I did use it for the first time today to send out our press release about the booster shots for Pfizer. And it works really well and it has a nice look to it. So I'll put the link if I can find it in the chat, but if you're interested in signing up for those as well, I know you all get my press release already, but there might be some other updates coming from other departments that you might be interested in. So thank you.
Thanks, Sam. Any questions for Sam? Okay, Dr. Claypack.
Good afternoon. Good afternoon and welcome back, David, after your hiatus from finishing at CMC and coming back to join us at the Board of Health. I'm sure we all very much appreciate your willingness to be in retirement, but put your hand in the ring here. I've had some very good interchanges with Andrea de Lima, who took over your position, and you must have done a wonderful job orienting her because she certainly seems to have her feet on the ground. Since I put out my board report, a couple of rays of light. The first and most important, I think, is that the national trend in cases is dropping. We have some hope that Delta may be on the downswing. That hope is tempered by our experience that these variants tend to have a 2 to 3 month lifespan, and one follows another. So that as we look forward over the coming, who knows how long, unless we get a grip on our continuing vaccination issues, the next variant may come along before we reach the end of the year. We also won't be able to get those kids vaccinated between the age of 0 and 11 years in that time span. It's going to be the end of the year, beginning of the next year. We've got to be prepared that we're dealing with the unvaccinated. But the ray of light is that nationally, the numbers are going down. The state reports in this last week have shown a decrease. And although we can't really personally attest that we see it on the county level, things hopefully will look a bit better for us as well. The other ray of light is a report in JAMA, of the Journal of the American Medical Association, looking at vaccine trends in terms of people hesitant to be vaccinated and those who are willing to be vaccinated. And while there persists a number of people who remain anti-vaccination, not willing to be vaccinated, there are trends in the upward direction towards vaccination. That's our public health opportunity, and that's our public health goal, is reaching out ever more aggressively to this population that becomes willing to be vaccinated and helping them to be vaccinated. So in every way we can, that is what has to be kept in perspective. The booster shots pale in comparison to vaccinating unvaccinated individuals. Our major public health mission is those unvaccinated people, and putting those resources and keeping that focus, I think is a challenge, because we have a lot of interest on the part of the public in getting a booster shot. A lot of primary care and other specialty practitioners are being asked about boosters. How can I get one, etc. But in spite of needing to meet that need, this other focus is the more primary one. And speaking of vaccination in the private sector, we have been ever increasing and ever encouraging, I should say, and offering to primary care offices vaccine and access to vaccine. And David, you'll find this maybe a little bit Pollyannish. I have been making a pitch that it doesn't need to be just primary care. We have a lot of people who don't go to their primary care doctor, or maybe they don't even have one, but they do go to their oncologist. They do go to their rheumatologist. They go to any specialist you want to name. And if those people would step up to the plate, if those specialists would step up to the plate and see discussion of vaccination and even the provision of vaccination in their offices, we could help to just capture those people who become willing to be vaccinated at the point at which their trusted physician, trusted nurse practitioner, trusted PA, whatever, says, you really should be vaccinated. You're one of those folks who would be, life might be saved. You might be prevented from being in the hospital. You're 17 times more likely to be hospitalized if you're not vaccinated. So my Pollyannish effort is to try and encourage as many offices as possible to step up to the plate and obtain vaccine. It's so simple. It's really much simpler to vaccinate people than it is to offer some of the therapies they offer. Far less complicated. So I mentioned a couple of rays of light. Boosters have come on the scene, as has been mentioned. There is significant discussion about the groups that have been targeted for boosters. I think the group that is clearest is the 65 and older group. It seems to be quite clear that boosters will help those folks. Of course, the third doses for immunocompromised, those aren't technically boosters, they're third doses. There's a fine distinction there. When you get to talking about the people with medical conditions and the other groups that have been talked about, employment and so on, then you begin to get into an educational debate. And I think you as members of the board who may be asked about this, it's only fair that you be aware that there is this debate going on, and you will hear educated individuals, experts in their fields, weigh in on this subject. With regard to our workload within the department, you may, as Board of Health members, hear something about our the change that we've had, in which we usually responded to all those cases within 24 hours. And now it's not that rapid, unfortunately. I've been explaining it to our practitioner group and asking for their patience, as we sometimes see several days between the time of notification of a case and the time we can complete our contact tracing, et cetera. Particularly burdensome for the school age population, in which parents get drawn into this and don't know whether their child should go back to school. The messaging is being improved. Some of the messaging coming from school districts has been vague and a bit ambiguous, and begs the question when they get a notification, should I quarantine my kid? Can I get together with these other families this weekend? Can they go to that soccer camp? All those are very practical questions, and we're well aware that they're being asked and that they need to have answers. And we're working assiduously to try to improve that communication. But it is a challenge, what we're dealing with. It's a challenge for hospitals, a challenge for practitioner offices. This mandate for vaccination of healthcare workers has had impacts. There has been Upstate Medical Center and St. Joseph's Hospital are on diversion due to staffing issues. Diversion means that if an ambulance needs to take someone somewhere, if a hospital's on diversion, they don't take them to that hospital. It's a sign of overload, and it's largely due to staffing issues. The Cayuga Medical Center has had to make some adjustments. Fortunately, they have not severely had an effect on care delivery, but they have had some impacts. Be that as it may, the Ithaca Journal, I think this week, has done a very good job in writing some articles about vaccine hesitancy, and particularly one today, which has talked about some of the issues surrounding that. They also broke it down into some detail, and I think those of us in public health, this week's Ithaca Journal series is well worth taking a look at. So I should end there. We have a long meeting. I don't want to take too much time. If you have questions, I'm glad to answer them.
Great, thank you so much. Any questions for Dr. Claypack before we move on? Yes, Sue.
Yeah, either Dr. Claypack or Frank. I was just wondering, for planning purposes, do you have access to where in the county the vaccination rates are lowest? So geographical information about who got vaccines and who didn't?
Yeah, we have it by zip code, so we are able to look at that. It's what you would imagine. The further out you get in the county, the lower the vaccination rates are. But generally speaking, we've been providing vaccine opportunities out in those areas for several months now. So yes, we're aware, and we are trying to reach those folks.
Other questions? Okay, moving on then to Deb and children with special healthcare needs.
Hi, everyone. I don't have anything additional to add to my report. Thanks.
Thanks, Deb. Any questions for Deb? Okay, Jonathan.
Hi. I think I'll just give a little clarification on where we stand on open meetings law, et cetera. As you may know, the Board of Health is subject to the open meetings law. The governor recently signed a law which allows but doesn't require counties to meet by Zoom, and including the Board of Health, but it only runs through January 15th. After that, who knows? Also, it's optional. So this group, the Board of Health can decide it wants to meet in person or not through January 15th. And after that, unless the law changes, we need to go back to in person. That's all I have.
Okay, any questions for Jonathan? Okay, Liz, environmental health.
The only thing I would like to say is that to add to my report, is that we have just got confirmation that we have hired a public health technician, Dylan Schultz, who will start on October 18th. And we continue to have overqualified people applying for these positions, for our tech positions. So he has a bachelor's in a bachelor's in environmental science and a master's in water resources, and has worked in Idaho and Alaska and Maine, and is now back in Newfield where he has family. So we're hoping he'll be around a while. So anyway, we're excited that we'll be have that full staff again in mid-October. And I'll take questions if anybody has any.
Any questions for Liz? Okay, Harmony, could you give us a little bit of an update from the mental health perspective? And then also, I don't know, Frank, if CSB has been meeting and we want to add anything, if you want to add anything as well.
Sure. So our last Community Services Board meeting was on September 13th, and we had a couple of items on the agenda. We did a small recognition activity for our board members. We also did our annual incident review and had a discussion on the bylaw changes. There's a work group for the Community Services Board looking at their bylaws with an eye on how to make them as compatible as possible with the Board of Health. And we also discussed the possibility of having a pharmacy be co-located at the clinic, especially pharmacy that really can cater to the needs primarily of people with mental health disorders. And we have looked at one particular pharmacy that does that called Genoa. So those were the big highlights, I would say, from our meeting. And this next month, we will be having somebody come and talk with the board members from the Mental Hygiene Conference about their role as board members, the history, their purpose, and that sort of thing, which should be a nice meeting for people to learn more about, the importance of being on the board that they serve on. So I think that's pretty much it. Any questions?
Yeah, so I just had a quick one about, and I don't know if Harmony or Frank is the right person to ask, or maybe Sam, in terms of the strategic planning efforts, are we back to a place where there should be a Board of Health member at the CSB meetings, or not yet?
Yeah, I mean, that was kind of independent of the strategic planning process. It was something the boards had both talked about. I think it kind of fell to the side with COVID. Yeah, I mean, I think if there's interest, we'd welcome it. Having some crossover as we continue to move forward with the merger, I think would be beneficial. But it's really up to the boards on how they want to participate.
Okay, so maybe would it be possible for Karen to send around the upcoming CSB dates? And if folks are available, are those being done by Zoom, or are they in-person meetings? There's
Zoom as well.
Okay. If folks are available, if we could spread that out and have somebody go to one of those, that would probably be beneficial to get back into the habit of that.
And we can do the same for the CSB for the Board of Health meetings.
Yeah, I mean, I think especially if they're looking at bylaws and alignment with Board of Health, it makes sense for people to be there, or for
that did remind me that the Board of Health at some point should take up looking at the Board of Health bylaws. There will be a component. So the bylaws for Community Services Board, there's a lot of things they want to address, but ultimately both will need to be addressed around the merger. So they've started in on the non-merger related things that they want to try to address. And the Board of Health might want to consider a small group that, takes a look at the board bylaws and sees if there's any adjustments, both merger and non-merger related, that we'd want to consider, because we will have to update both of them as part of the merger conversation, because just because they need to be updated for that.
Okay. All right, I'll come back to that, Frank.
Sure.
Okay, any other questions for Harmony, Frank, or anything on this before we move to our enforcement actions? Okay, so lots of enforcement actions. I'm going to start with the first resolution related to Clubhouse Grill. And hold on, because I know we got some emails on stuff too. This one was upside down in the packet, but Karen was kind enough to send it to you by email. So if you couldn't read it well, you can look in your email on this. So let's go ahead with putting a motion on the floor to approve as written. From someone. I have a first from Melissa and a second from Sue. Okay, let me just have Liz, is there anything in addition to what's on here for discussion that you'd like to talk about?
Yes, I would like to say that this was originally on the Board of Health agenda in August and did not go forward. So we need to change the penalty due dates to November 15th. And I'm happy to provide a summary if you would like, a quick one, or however you'd like to deal with that.
Can you just do a really quick summary for us?
Yes, this is this facility, Clubhouse Grill, was operating without a food service permit. They did not submit it within the time frame that they were supposed to, and there was communication back and forth between the health department and her at various times. She submitted an application on September 30th, one day before her operation on July 2nd or July 1st when her permit expired. However, she did not have a complete application and we could not issue it. And we were unable to get in touch with her. She did not get back in touch with us to see that her permit was issued or if there were any issues with it before she operated on July 1st.
Okay, any questions on this? Further discussion? Okay, so to approve as written with the friendly amendment that we changed the due date to, I'm sorry, Liz, did you say November 15th or November 1st? November 15th, right?
Yes.
Okay, all in favor with the as written, but with the change to November 15th as the due date? Anyone opposed? And abstentions? Okay. Okay, next item is the second resolution, which is the Rodnick Adventure Camp. So if I can get motion to approve as written. First from Ed, a second from David. Let's go ahead and open for discussions. Liz, if you can give us a quick overview on this one, as well as this another one that needs an extension to November 15th because it was on the.
That is correct. This
Okay.
one was on the August agenda, so we need to change the penalty due date to November 15th. It is a children's camp that operated without a permit with a $400 fine. There was communication. There was not much communication, but EH had reached out. There was no communication between May 24th and June 22nd. Children's camps permits have a lot of documentation. Staff have to be certified, their background checks and training and CPR and a ton of things that have to happen for a children's camp to be permitted. And all of that was not able to come together when she submitted the permit, or he, can't remember, on both on July 6th, we were not able to issue it, and then they went ahead and operated on July 12th.
Okay. Any questions on this one? Okay, all in favor as written?
With the change.
With the, I'm sorry, right, with the friendly change to November 15th. Anyone opposed? And any abstentions? Okay. All right, moving on to our third enforcement action. This is the one related to Old Mexico. Is that, am I right? Yes, Old Mexico. Okay, a first motion to approve is written. First on this. Okay, Sue with a second from Shauna. Let's go ahead and open for discussion. And Liz, we're into the new enforcement actions now, correct? Okay, so these are current ones.
Yep.
Okay, any additional things we need to know about this one?
So this one, it's a restaurant, and they had cooling equipment issues. They have since ordered the cooler, which is a significant investment. They attempted to replace the, both of their violations that they had were due to this cooling equipment. And after the first inspection, they attempted to fix the equipment, but it was not successful. And then when we went back for a second inspection, after that, they ordered a new piece of equipment. They did fail to monitor temperatures, but they have put a lot of effort, failed to monitor temperatures in the cooler, but they did put significant effort into the replacement. So, we have proposed the standard fine of $400, but due to the efforts that they took, we would also be okay with a fine reduction in this case.
Sue?
So there's two letters for them. One is without the $400 fee and one is with. So which one are we considering now?
There's two.
Well, there's a draft resolution and a stipulation agreement and orders.
So the draft resolution is what the board acts on. Our process is that we send a stipulation agreement to the facility for them to review and sign if they are open to that. So the stipulation agreement does have the $400 proposed penalty in it. And then that is carried forward in the draft resolution.
Oh, okay, it's up above. Got it.
Yes, they're formatted differently. One's going to the facility. We don't explain the background as much because they're typically aware.
Right. But you said that because of the investment they've made, you would consider a reduction?
And the effort they made in between the inspections as well to try to fix the equipment.
Okay, Ed?
Just a question about their history. Have they had any prior significant violations? Because I don't see a history here for their.
So they certainly, I'm sorry, I'm not positive whether they've ever had a critical violation. A lot of restaurants do, but if they correct them, it's we don't take enforcement. So they do not have any prior Board of Health actions within at least 3 years. And my understanding is typically they're a good operation.
And so, Liz, when we have done fee reductions before for equipment investments, did you have a proposal that you wanted us to consider?
I'm not sure I'm following your.
So when you're saying, I think what I
see what you're saying. So okay. A lot of times people do not take action until they get the enforcement orders, right? And this owner has acted differently. So I do not know that we have proposed these in the past, but generally there is often not any action to try to correct it until they get caught again.
Okay, and so, sorry.
I guess so that we have some discussion, I was going to propose an amendment that we reduce the fine from 400 to 200.
Great.
Second that.
Okay, we've got a second on that and a third. Okay, so it sounds like is there any additional questions or discussion on this? So we're voting on approving as written, except with a reduction in the fine from $400 to $200, correct? Okay, all in favor of that? All opposed? And any abstentions? Okay, great, thank you. All right, moving on to number 4. What's number 4 on the agenda, which is Warrenwood Apartments. So looking for a motion to approve as written. By Shauna, first from David, a second from Melissa. Liz?
So this one is easier. This one is an apartment pool that we inspected twice, and on both occasions they had inadequate bromine disinfection levels in their pool. And so we're proposing our standard fine of $400.
Any questions on this one? Discussion? Okay, all in favor? Oh, sorry, go ahead, Sue.
Yeah, I'm assuming that the bromine levels are easy to monitor, and that's just something that the pool operators are supposed to do themselves.
Yes, yeah. It's not an uncommon issue with some of these pools that are not the main business. So you have somebody who's often doing it where it's not their main job.
So is it that their levels were high or that they haven't been testing?
No, they were out of compliance with the required disinfection levels.
Okay, because I
Not
wonder
that
if
they
the
were monitored.
rain has something to do with it. I mean, if your pool gets diluted out, can that have an impact at all?
They would still need to monitor, right, and to make adjustments. All operators have to make adjustments to changing conditions.
Other questions, discussion? Right, all in favor as written? All opposed? And any abstentions? Great. Okay, moving on to resolution number 5, which is back to Ronick, but it is a different enforcement action related to the pool. And so just to clarify, and so do we have a motion to approve as written? I'll do Melissa first, David second on this. Liz, if you could give us a quick overview of this.
This is another quick one, very similar to the previous situation, except in this case, they use chlorine and bromine. And again, it was out of, was inadequate disinfection with 2 inspections. So we're proposing a fine of $400.
Any questions?
Just kind of for background, I assume this kind of monitoring and adjustment is relatively easy. It's more in both these cases, just not doing it.
We offer training, right? We will work with the operators to make sure they know how to do it. You are dealing with chemistry, right? So whether that's easy, I think might depend on the individual, but for, operators can successfully do it. Yeah, so it's, we do work with them and provide training and try to make sure that they know how to do it and that they're using the right, reagents, everything. The one thing though.
And there are commercial services they can hire to do this if they want. I've seen pool trucks go around. I assume they do this.
I'm not sure about that, actually, whether the pool trucks are for community pools or more individual pool, maintenance, because I'm not aware of anybody doing that. It's not like water supply operators. I know we do have some roving operators that manage multiple supplies. So I'm not sure if that's the situation, but typically they can hire somebody to do it if they can't find a company. One reason that you are seeing some of these pool things all together is because, we've had to compress our inspections because of COVID. So it's not that they're necessarily more, there might be a couple more, but it's more that we are having to do all of these inspections in a very compressed time frame this year.
So a good business for some, retired person or chemistry or public health professor.
You might be able to find employment if you are looking for such.
Okay, any more discussion on this one? All right, all in favor as written? All opposed and abstentions? Okay. we're on to enforcement action number 6, which is another pool. This is the Best Western. And also Karen sent out to everybody in your email a note from Best Western, who is asking for a fee reduction from $400 to $200. So just kind of keep that in mind as we get to the discussion phase here. So let's start though with a motion to approve as written. First from Ed and a second from David. Let's go ahead and Liz, is there any additional discussion on this aside from the same pool discussion we just had with the other two? Is there anything different with this one?
No, there is not.
Okay. There is the letter with the request for the fee reduction from $400 to $200. Do we want to take that up for discussion? Okay, any questions for Liz on this? All right, all in favor of approving then as written? Okay, all opposed and abstentions? Okay, great. All right, we're off the pool. We're off of the pool enforcement actions now, but we're not done with water quite yet. So now we're moving into water, resolution number 7, which is the Brew 22 coffee resolution. So let's start with a motion to approve as written. First from Melissa, second from David. Liz, if you could just start us off here.
So this Brew 22, it's a food service with their own water supply. So they're regulated as a public water supply and have to meet requirements. This is, they are in violation of Board of Health orders from 2020 for water monitoring and sample issues. They failed to submit the 3rd and 4th quarter bacteriological samples in 2020 after the Board of Health issued their resolution in May of 2020, and they have also failed to submit the 2nd quarter samples in 2022. At the time that this order was written, they had also failed to pay their operating fee and the late fee the operating fee we have for public water supplies. We don't issue a permit, but they do pay an operating fee since we do inspect them. The 3rd quarter samples aren't due yet, so I don't know whether they'll get those in. And I did hear that they have paid the water fee and the late fees since the draft orders went out.
So number 2 on this has been satisfied already.
Yes.
Okay.
Yes, they have done that. So we're proposing a fine of $600 for this.
Okay. Any questions on this one? And Liz, just so oh, sorry, go ahead, Sue.
I just wondered if there were any extenuating circumstances. It just seems like you tell them to do something and then they don't do it and then they don't do it again.
That's pretty much our impression on these things, that we do, we send out sample schedules. They know what they are supposed to do. Those go out at the start of every year. If they are late, they get a notice by email. If they still don't get it in, then we send out a notice of violation. And if they don't respond to that, then we end up going to enforcement. We tend to have to batch these because of other workload issues. So that's part of why you're seeing these now.
Melissa?
Were they open during this time? Because this was COVID shutdown time.
So they've been submitting reports. I've actually driven past there, so I know they've been open at least some of the time. We did not include a fine for violation of Board of Health orders, actually. We just kind of assessed the fine based on the failure to submit the sample results because of possible concerns with COVID with operation in 2020.
And there was no, the companies that do this for them weren't shut down or closed because of COVID or anything was.
Other questions? Okay, so we'll vote on approving as written, except striking number 2, assuming that that's been paid, correct?
you can keep it in there. I don't think there's a reason to modify the resolution. They've just met the requirement.
Okay, that sounds fair. So voting on approving is written then. All in favor? All opposed? Abstentions? Okay, let's move on. Our next resolution, we're on to number 8, which is grassroots, about the campground mass gathering. So let's have a motion to approve as written. First from Sue, a second from David. Liz.
This one is not as easy to explain, but I will give a summary, especially since some board members are new to this and didn't suffer through it last year, or no, in 2019 with us. Grassroots typically has a what is regulated as a mass gathering when they do their Finger Lakes Grassroots Festival. And they have had a history of violations during that mass gathering. There were Board of Health orders issued in 2019 about their mass gathering. So, and those Board of Health orders contained provisions about complying with campground regulations, because they also typically operate campgrounds as part of their pre-activities to the festival. So in this case, they did not have a festival in 2020 because of COVID. In 2021, they ended up having a series of concerts during the month of July, their typical festival month, and they offered camping on those concert weekends. And we had discussions with them. They have a campground at across the way, and then they also have a campground on the fairgrounds, the Trumansburg Fairgrounds, where the concerts are held. And we had discussions with them about whether they needed a camping permit on the festival grounds, which we call on-site. And they had said, no, they were going to limit the campers on the festival grounds to 4 campsites, which means they are not regulated at a campground. And then they're required to submit a permit 30 days in advance. Instead, on July 6th, they submitted a campground permit for on-site and wanted to start operation on July 9th. And we were unable to, they were unable to meet all the requirements until July 23rd. But both July 9th and July 23rd are less than 30 days. So they did not submit their campground permit application 30 days in advance of operating, which they are required to do under the regulations. They also did not submit the plans for they have to set up temporary water systems. And for the fairgrounds, they did not submit those plans 30 days in advance. They also installed that water system without approval by us, which was documented by the dates on the engineering certifications and plans that they have to submit. They had a much smaller number of campsites this year. We only regulated them as a campsite because it was as a campground, because it was a smaller event. So they had a much smaller number of campsites than for their mass gathering, but we still had some of the same issues with their water system, with not marking out the campsites correctly, with not putting markers on the campsites so people would know where to go. They had people camping in unapproved locations. You're required to camp within 250 feet of a water spigot, and they had campsites that were outside of that range. It was not nearly, the violations weren't as extensive as they've been at the mass gathering, but they still had multiple instances of not maintaining the 10-foot separation that is required between camping structures. I think that's most of it. They also had a questionable water sample at across the way, and they failed to make that spigot unavailable because they were required to have it not be used since it had not passed the bacteriological samples. So because of that, we have issued these orders for violating the campground code And then since they have not had a mass gathering since the orders were issued in 2019, we have essentially moved those requirements forward to 2022. There's some minor modifications from the 2019 order. We changed, we had required in 2019, we required geo-referenced maps that seemed to be somewhat problematic. So we're just saying submit accurate maps. And we've also added language on not advertising the campsites until they have approval from us, because they did advertise campsites without approval this year, and Frank issued public health director's orders to have them stop, which they did. And then we've also added a order regarding the storage of their temporary water pipes, because we're concerned that they are storing those, they're not storing those in a protected place or adequately. So we've proposed a fine of $1,500. I will say that Elaine Springer called me very shortly before this meeting and is dealing with a public health a family emergency, and was unable to speak. I had a brief conversation and about if she wanted me to relay anything, and she essentially just said, that they're prepared to meet the upcoming deadlines. There's, I think, an October 1st deadline for their website and another one, I think, in November 15th. So she didn't provide much information, but she did say that. So.
Okay. Questions or comments from the Board of Health?
Every year, this is kind of like a thorn in our side, because they have a meeting, but then they don't follow through. And have they paid all of their previous fines? Are they up to date? And
yes,
so now we're just trying to make sure that everything they've agreed to in the past will be done again yet this year.
Yeah,
the
in
way it was
2022. Yeah. And we have put in the resolution, where I think this was something similar was in the previous order in 2019, but that, we can fine them up to $500 for each violation, which would mean like each campsite separation violation, and camping, each campsite not in the right place, or water supply problems. So we've tried to lay out actions in the 2019 order that are in this order, to help them be in compliance. The early setup is critical, and then having enough people to adequately oversee their operation. So we're always hopeful. But we are, we've made some improvements in working with them, but we are reaching the limit of running out of things we can do besides what's in this order.
Mm-hmm. All right. Any other questions or comments on this? Sue?
Yeah, I just wonder, are there set times for the deadlines to file papers that you're going by that are standard, like, the camping plans and the water plans, or can you move them up so that they have to deal with things earlier, or have you already done that? And I'm looking forward to 2022.
So we've essentially done that. I mean, the application that they submit is quite complex and comprehensive. So that's part of our issues, but a lot of the issues have been on their setup. And so we have laid out, instead of they're required to have the inspections done, I think it's 48 hours in advance, might be 72, but I think it's 48 hours in advance of their permit or advance of the event. And we have put in deadlines in the order, which we did in 2019, so that we're doing phased inspections. So we're going to go out there once and they should have the roads laid out. Right. And that's when we can make sure that there aren't trees in the middle of the road like there have been sometimes. Right. And we can go out again. Then I have another one where we'll have the the campsites laid out and check to make sure that they actually have those laid out and marked. So that's our approach. And they had agreed to that in 2019, right? They agreed to the schedule that we proposed. It's an open field or open area. And, so if they mark things or that they mow, right, you can't have it too far in advance because things can destroy what they put in place. But so they did agree to this schedule back in 2019. And that's what we're hoping will help them at least get everything laid out correctly, which should benefit the whole operation.
Other questions, comments? All right. All in favor of moving forward, approving as written? All opposed? Abstentions? Okay, let's go ahead and move on to John Joseph, number 9, John Joseph Inn. So a motion, hold on a second, I gotta scroll down through here, okay. John Joseph Inn, to approve as written. A motion, please. A first from David, a second from Ed. All right, Liz.
So this is similar to the Brew 22 orders. This is it's actually a temporary residence, a hotel with a food service that we issued, but they have a water supply, and we issued orders. We previously issued orders in 2020 for failure to submit samples. I can't remember if it's samples and monitoring reports. And they failed to submit the first and second quarter bacteriological samples this year, and they are not submitting timely monthly operating reports that all water systems are required to submit. They submitted their monthly operating reports when we did their inspection. So we have proposed a fine of $600.
Okay, so consistent with what we did on the other one. Okay. Any questions or comments on this one? Okay, sure, Ed.
No, it looks like it says $500. Is that what you meant?
No, that's the previous one.
Oh, that's the previous one. Oh.
Yeah, the current one is 600.
Okay, thanks.
Yeah.
Yep.
You guys are out of practice on this.
I know.
Yeah, really.
Any other questions or comments? Yeah, Sue.
I just wonder, there haven't been any COVID impacts. Have they been operating all this time? Do we know?
I'm not sure about 2020, but this is for 2021 violations. And we also did not assess an additional penalty for violation of Board of Health orders because of COVID.
Any other questions or comments? Okay, all in favor as written? All opposed and abstentions? Okay, last one, number 10. Oh, Liz, a little out of order. We're back to the pools. This is Country Inn and Suites related to their pool. Can I have a motion to approve as written? First from David, a second from Ed. Liz, any discussion on this?
Yes, this one is somewhat different than the previous two. This one is violation of Board of Health orders for their pool. They were, this is a pool inside a hotel, and when we issue the hotel permit, we are also issuing approval for their pool, but they cannot operate it until they have a pre-operational inspection. And they were, when we went out and did our hotel inspection on September 7th, the pool was in operation without having had the pre-operational inspection. It was again in operation on September 8th. And then on September 8th, the bromine was inadequate in both of their pools. The board waived the penalty in 2020 due to COVID, and because the pool closed, I think, shortly after the violations had occurred in 2020. But we are proposing a penalty of $1,000 for this year. And we're also adding a requirement in this case that they submit monthly operating reports for the pools, since they have continued to have problems in this area.
Okay, questions or discussion on this? Okay, all in favor? Oh, go ahead, Sue.
Sorry, that seems high.
That's
Can you
okay.
explain where the 1,000 came from?
Yes, so we essentially assessed penalties of $400 for the lack of bromine or the inadequate bromine in each pool, lack of inadequate disinfection in 2 pools, $400 for violation of Board of Health orders, and $200 for violating and operating without the pre-operational inspection.
David, did you have a question?
Penalty had previously been waived. We did include penalties this time.
Sorry, Liz, that I talked over you. Okay, Sue, did that answer your question? Did you have a follow-up? Okay. And then David, did you have your hand up? Okay.
No question.
Okay. Any other questions? All right, all in favor as written? All opposed? And abstentions? Okay. I think that closes out all of our enforcement actions. And I didn't miss anything that came by email, right? I think I got everything. Okay. So establishing a nominating committee, Frank, I'm sorry, can you remind me, what is this for?
Sure. So Sue and Ed's terms will both be expiring at the end of the year. And so we need to form a nominating committee in order to make recommendations to the legislature. I've reached out to both Sue and Ed. Sue is interested in being reconsidered. Ed is still working with his employer to see if it aligns. So hopefully the work of the nominating committee will be easy, but we do need a committee to be able to review interested parties, whether they be existing or new applicants.
And how many people do we need for that committee, Frank? 3?
It's usually been 3.
Yeah. So I'll volunteer. I'm happy to do that. Melissa will volunteer. Is there one more? And David will volunteer. There's your committee.
Great.
Okay. And Ed's volunteering to be on the committee.
Yeah.
Just kidding.
I just wanted to mention that barring any unforeseen circumstances, it looks like the stars may be aligned for me to continue doing this. So
Okay. Great. That would be great. So thank you.
If they say no, tell us who to talk to.
Right.
We'll slap them with a pool violation.
Yeah.
I think that was a billiard truck you saw, not a swimming pool truck.
All right, my friends, I think that is everything on our agenda. Did I miss anything, Frank, or we're good?
No, just we should talk offline about the bylaws review and
Yes.
how you want to approach that.
Okay, let's do that. Okay. All right, everybody. Thank you so much. I'm going to go ahead and adjourn the meeting. We finished our agenda for the day, and have a great month of September, and we'll see you in October. Okay. Bye-bye.
Bye.
Hey, Frank. Do you want to, can you hang out
Hold
for a
on.
second?
Hold on.